there, my name is Stephanie Maxwell and I'm a registered massage therapist. I'm here today to talk to you about breast massage. There are many benefits of breast massage throughout all stages of life. Some of the primary goals of breast massage are to decrease congestion, decrease edema in the breast tissue, to improve circulation, to improve posture. It can be helpful with painful breast syndromes such as mastalgia. Post-surgically, breast massage can help with scar tissue formation, and breast massage can be very helpful throughout the pregnancy and postpartum period. The breast massage treatment itself can be adapted based on the client's comfort levels and needs. The breast massage can be performed through the sheets if the client would prefer not to have the breast undraped. The RMT is never touching the areola, and the massage itself is very light and gentle in nature as there are no muscles located within the breast tissue. The RMT can use a variety of techniques to obtain the client's goals, such as hydrotherapy, lymphatic drainage, general Swedish massage. I wanted to talk to you specifically about the benefits of breast massage in the pregnancy and postpartum period. Breast massage can help to normalize an ever-changing body. It can help to reduce some of the aches and pains associated with pregnancy and the postpartum period in general. It can help to improve milk production and milk flow to the breast tissues. It can help to decrease the occurrence of plugged ducts and therefore the occurrence of mastitis. And it can also help to decrease the musculoskeletal aches and pains of prolonged breastfeeding positions.